Hi, my name is Chiarello, and this is my PowerPoint presentation on trauma, specifically on sexual assault. Brief overview of what sexual violence is. It's actually a really broad term that can encompass various forms of non-consensual sex acts and behaviors. It can occur in different contexts, like intimate partner relationships, families, during armed conflicts, and in a variety of different social settings. And understanding the symptoms and impact of that sexual violence is crucial for addressing the consequences and then supporting survivors. It's important to note that experiences of sexual violence are going to vary across individuals and across different populations. So the different forms of sexual assault, sexual violence, I've listed a few examples such as rape, attempted rape, sexual coercion. This can include sexual harassment, sexual exploitation, such as human trafficking. It encompasses things like child sex abuse and sexual assault by intoxication. Looking at the symptoms of sexual assault, it can actually have a really profound and lasting effect on survivors. Common symptoms in a psychological aspect are things like depression, anxiety, PTSD, including things like flashbacks, intrusive memories, and nightmares. If we look at it from an emotional impact perspective, victim or survivors will experience things like guilt, shame, anger, fear, trust issues, betrayal. The more physical manifestations can include things like trouble sleeping, changes in appetite, fatigue, sexual dysfunction, physical pain, and it can also include things like sexually transmitted infections, STDs or HIV, and things like pregnancy as a result of rape. Cognitive responses could include things such as difficulty concentrating, issues with memory, hypervigilance, and things like the change of self-perception, so the negative belief that they could now have about themselves. If we're specifically to look at things like symptomology, and more specifically across historically marginalized populations, their experiences related to sexual violence can be influenced by things like cultural, social, or systemic contexts. And historically marginalized populations, racial, ethnic, LGBTQ, and individuals with disabilities may face additional challenges, of which I've listed a few. Stigma and discrimination. Marginalized populations may experience heightened stigma discrimination, making it much more difficult for them to disclose or seek support. There are cultural factors to consider. Cultural norms, expectations could impact how sexual violence is perceived and also reported. Some communities might even discourage open discussion about sexual matters, which could just further stigmatize survivors. There are systemic barriers, so access to support services, legal recourse, healthcare might be limited for historically marginalized populations, and that's due to systemic barriers and inequalities. Intersectionality-wise, individuals who belong to multiple marginalized groups may face compounded challenges. So a queer person of color, for example, might experience unique forms of discrimination and might have these intersecting identities that impact their experience of sexual violence. And also general barriers to reporting. So the distrust of authorities, things like fear of discrimination, systemic inequalities could deter survivors from reporting at all. So there are factors that contribute to resilience when it comes to coping with trauma, and things such as social support. So a social support network is crucial to building resilience. So in the face of trauma, having supportive relationships like family, friends, colleagues, community members provides this buffer against its negative effects. Social support can also offer emotional validation, practical assistance, and a sense of belonging, all of which aids in coping and then recovery. So the feeling of being connected to others as well as having a support system can reduce the impact of traumatic experiences and enhance your sense of security as a survivor. Secondly, cognitive coping strategies, so the way individuals interpret and cope with trauma plays a significant role in their resilience. An important aspect of this is the ability to manage emotions and thoughts effectively. It could include developing a positive mindset, reframing negative thoughts, or finding meaning and purpose in adversity, and then utilizing that to problem solve. So having an adaptive, constructive approach can increase the chances of overcoming challenges. Resilience is a really dynamic process, influenced by many factors, including individual characteristics and the environment, and then obviously the nature of the trauma. So resilience can't be built with a one-size-fits-all approach. It's often going to require a combination of internal and external resources as well. So when we look at the role culture plays in overcoming trauma, we can see that culture shapes how people experience, interpret, and overcome that trauma, influencing the entire meaning that's attributed to that experience. Cultural norms dictate perspectives on appropriate behavior, appropriate emotional reactions, and responses to adversity, impacting coping mechanisms and also help-seeking behaviors. Various coping strategies such as religious practices or storytelling can be used to reflect cultural beliefs and provide a sense of identity for the survivor. If we look at cultural norms, they can contribute to this already pre-existing stigma around mental health, which requires effort to kind of challenge and address these stigmas for more open dialogue and support. The language that's used also plays a vital role in expressing trauma, and social workers, therapists need to be not just culturally competent, but utilize cultural humility to better navigate diverse communication styles with trauma survivors. Cultural identity impacts individuals' understanding of life's meaning, and it's guiding the process of integrating trauma into their lives through these coherent narratives. And lastly, culturally humble professionals with competence and respect for these diverse backgrounds can often tailor interventions more effectively to offer a better level of support for survivors. So when it comes to interventions, there is never going to be a one-size-fits-all, as there's going to be different interventions that are better for different cases. But I think the most widely used and recognized is trauma-focused CBT. So choosing the right intervention is going to be completely dependent on the trauma's nature, severity, the age of the individual, their cultural background, and personal preference. And with trauma-focused CBT, it stands out as a widely used, recognized, and effective approach, especially looking at the research when it comes to children and adolescents. It's backed by empirical support, combines CBT with more trauma-sensitive interventions, which addresses both the cognitive and the emotional aspects of the trauma. And as I said, it's extensively researched, showing positive outcomes in reducing trauma-related symptoms. So trauma-focused CBT its comprehensive approach includes psychoeducation, cognitive structuring, exposure techniques, and family involvement. And it does play that family participation is crucial in creating this supportive environment for recovery. It is a flexible intervention. It adapts to varying age groups, recognizing trauma's developmental impact throughout. And it's a structured framework that sets very specific goals and milestones, aiding systematic progress tracking in trauma recovery. It's integrating CBT with a more comprehensive approach to recovery, and this can be done by addressing both cognitive distortions as well as the behavior patterns linked to trauma. And while it is evidence-based, it needs to be certain that it's considering individual preferences, cultural factors, and trauma circumstances, which is crucial. There are other approaches, things like EMDR, narrative therapy, or mindfulness, which could also be effective. And I think it's dependent on the situation as to which would be used. So we have to look at the strengths and limitations of trauma-focused CBT. Strengths, it does come with strong empirical backing, effectively reduces trauma-related symptoms like PTSD, anxiety, and depression. It also has this holistic approach, so it targets cognitive, emotional, and the behavioral aspects. So using techniques like cognitive restructuring or even exposure therapy. It also recognizes the family role, so trauma-focused CBT involves caregivers, fostering a supportive environment and improving overall well-being. If we look at the limitations, it is time-intensive in nature, which could pose challenges for those who have busy work schedules or any financial constraints, because it would mean a lot more sessions. Exposure therapy, though it is useful, it tends to initially distress individuals, and that could put them off going back for further treatment. It does focus on individual and family factors, but it may not sufficiently address societal and the cultural aspects of trauma unless it's paired with another perspective. It's crucial to supplement with interventions considering broader context, so that ensures it's client-centered, it's culturally sensitive, and more comprehensive. So it may mean pairing trauma-focused CBT with another perspective or theory. So when looking at whether or not trauma-focused CBT actually addresses the needs of historically marginalized populations, it can be adapted to address their needs to some extent, but its effectiveness in fully meeting them is going to vary. It's proven effective for trauma, but it requires cultural competence for those populations. So therapists need to understand cultural backgrounds, address any language barriers, and adapt to diverse communication styles in order for this to be an effective form of treatment for people from marginalized populations. There are needs to recognize the systemic factors affecting these populations and that they might not be fully addressed by trauma-focused CBT alone. It may be that therapists are required to supplement it with other interventions, which also collectively advocate for social justice in order for this treatment to be effective. In doing that, it also means acknowledging that these intersecting identities exist and working the intervention around those. It does have a flexibility that allows for adaptation to cultural norms, in which it could be a useful treatment option. I think its success is going to depend on the therapist's cultural competence, adaptability, and importantly, the awareness of systemic factors, emphasizing the need for, I think, more culturally sensitive approaches if this is to be utilized in order to treat survivors of sexual violence from marginalized populations or communities.